I'm Dr. Susan Thibeault. I'm a certified registered nurse anesthetist. I have over 15 years of patient monitoring experience, in particular airway and respiratory monitoring. I'd like to share with you some of my experiences in clinical monitoring in the area of capnography and oxygen delivery. So sometimes people ask me, Sue, why does the sampling line matter? So if you have a tool that you are using at the bedside that can detect very early compromise, don't you want to make sure that you're using that tool accurately? So a key to obtaining accurate capnography values doesn't necessarily lie with the monitor itself. It really relies on your sampling line, right? What is attached to the patient? And it's this disposable device that may seem so innocuous, but there really are differences in all of the products that are out on the market. I like to compare it to tires. Tires on, if you had a sports car, high-end sports car, and you put repurposed or refabricated tires that are lower quality on that car, you're not going to get the performance out of that engine and transmission as you would if you had tires that were brand new and designed for that sports car. So why limit yourself with a disposable that is going to limit your capabilities? Because so many decisions are based on using an appropriate filter line set. Some of the variations in the sampling line, for example, might be the different cannula shapes, the cannula sizes, the pressure systems. A big one is the length of the actual sampling line tubing. Something that is way too long, you're going to have a delay in the patient's exhaling and that gas getting to your monitor. Filters. Certain filters can get clogged. Certain filters don't have viral particulate filters in them. Some of them retain moisture, and that would impede your samples, and even just the materials themselves. Connection ports are another big issue, whether they disconnect, whether they're tight, whether there's issues with the interfacing of these designs, are all things to consider when you're deciding to put a monitor with a sampling line on your patient. Because all of these not only affect the capnography readings, but they also affect the oxygen delivery. Oxygen is a drug, and just like all drugs, we have a dose response curve. And when you give a tablet or an injection, you know that you are administering 2, 4, or 6 milligrams of said drug. If you have a patient on a nasal cannula that's delivering 4 liters of oxygen and the patient is breathing through their mouth, do you know that they're actually receiving what you intend to receive? So an optimal device would be something that could be comfortable for the patient, allow the patient to talk, be heard, take in PO fluids if indicated, and not have an obstruction around their mouth, but something that would also very comfortably deliver accurately oxygen to both the nose and the mouth area, so that you could know with confidence that if you are giving 4 liters per minute, that the patient is actually receiving what you intended to deliver. I don't want to second guess the quality of my readings. I don't have time for that. And I think a lot of us are facing, time production pressure, and we want technology we can count on. We want technology to work for us and not the other way around. Their sampling lines offer this accurate representation of the CO2, the carbon dioxide that's being exhaled, but at the same time giving us an accurate respiratory rate and ensuring the quality and the quantity of oxygen delivered is indeed accurate, to ensure that patients who are mouth and nose breathing are getting the oxygen that we intend them to receive.